Okay, sure. Let me go get it for you. 1 second. Dr. Bush.
Hi there, I'm the pharmacist. How can I help you?
Hi, I think I'm having an allergic reaction. My stomach is really, really upset, and I think I'm about to die.
Okay, well, is that the only symptom that you're experiencing?
Yeah.
Okay, it sounds more like a drug side effect. What is the drug that you're taking right now?
Augmentin.
Okay, yes. Augmentin does typically present with some stomach upset as a side effect. So some ways that you can combat that is by taking it while eating. Could you try that?
Okay, sure. I'll try that. Thank you.
No problem.
So what are the differences between like the side effect of a drug and a true allergic reaction like anaphylaxis?
Okay, so side effect typically involves stomach upset, headache, or dizziness, whereas anaphylaxis is a true allergic reaction that involves itching, oftentimes with hives, shortness of breath, and tachycardia or like increased heart rate.
So something like that? Oh my gosh, I think she's having an allergic reaction.
Can you have a piece of this?
Alright, this is an EpiPen, okay?
Let me take your pulse.
So what is a true allergy? Some signs and symptoms you would typically see in a true allergy are redness, hives, tachycardia, shortness of breath, and swelling. There are different types of classifications of a true allergy. Type 1 is mediated by IgE and is seen within 30 minutes to 2 hours of taking certain drugs or vaccines such as the ones listed in the far right column. Type 2 is typically cytotoxic and has a later onset occurring between 3 days and weeks after taking a drug. Type 3 is typically an immune complex and has an onset similar to a cytotoxic reaction. Type 4 is typically cell-mediated and associated with some type of rash and has an onset of over 3 days, but is not typically as long as types 2 and 3. The most common causes can be foods, venoms, latex, and medications such as beta-lactams, NSAIDs, chemotherapy, monoclonal antibodies, or insulins. So the importance of EpiPens. Adults and children with a history of severe reactions to food allergies or bee stings are advised to carry an EpiPen with them constantly. Bees can attack unpredictably if you disturb their hives. It's also impossible to predict when a food allergy will occur, and many people don't know they are allergic to a certain food until eating it. People who are allergic to peanuts can discover that they've eaten something containing peanuts without even knowing it. Anaphylaxis kills between 150 and 200 people annually in the United States, and EpiPens can help to decrease this number. Doctors now recommend that anyone with a known allergy, whether to food or bee stings, should carry 2 EpiPens for 2 different reasons. One dose might not be enough to treat the reaction, and it's possible to botch the first shot. The second EpiPen then becomes a welcome backup dose. In the picture, you see 3 EpiPens. Each pack contains 2 live ingredient EpiPens along with a training pen so you can become comfortable with the motion of injecting yourself. So, what is a pseudo-allergy and what makes it different from a true allergy? A pseudo-allergic reaction is not immune system driven but can resemble an allergic reaction. Some examples include aspirin-induced asthma, opiate-related urticaria, and red man syndrome. What will you see in a pseudo-allergy? Some signs you may see in a pseudo-allergic reaction are upset stomach, diarrhea, drowsiness, headache, and vomiting. Are you having an anaphylactic reaction? Normally, you will have a heart rate of about 60 to 100 beats per minute, a respiratory rate about 12 to 20 rates per minute, and no trouble swallowing. In anaphylaxis, your heart rate is going to be elevated, your respiratory rate is going to be decreased, and you're going to have difficulty swallowing. To be fully diagnosed with anaphylaxis, you will be experiencing one of these three scenarios. Acute onset of the skin, mucosal tissue, or both, and at least one of the following: respiratory compromise or reduced blood pressure. 2 or more of the following: involvement of the skin, respiratory compromise, reduced blood pressure, or persistent GI symptoms. Decreased blood pressure after exposure to a known allergen.